There are small health systems that are out there doing a great job, but they can't do it all. They need to focus on you being an inpatient or you having some kind of, physical deal. And when you walk out of there, you're not on your own. Where you go, come here. You're not on your own. Come to the wellness center. Come to that space where you can come find anything that you need, from just having an educational class and learning how to cook or learning how to walk or reading a book or having a spiritual conversation, or if you need to have a mental health conversation, that's the space where you go. And so we want to take those centers and put them in every community where there's a space where people can go, feel safe, be easy, and have any conversation you want to have about your health. That's the part of bringing that community back together in that space.
Welcome to Care More, Be Better, a podcast for people like you who care about the social impact of conscious companies and everyday heroes. Hear inspiring stories from those who put people and planet before profit and personal gain. You'll learn how you can make a difference, vote with your dollars, and get involved today. Here's your host, Corinna Bellizzi.
Hello and welcome to Care More, Be Better. Each week, I invite you to care more about a specific social or environmental issue so that we can create a better world together. Today, we're going to deepen our discussion into health equity as I'm joined by a healthcare professional from my neck of the woods, DeAndre James. DeAndre has worked in various roles within the sector, beginning his career as a hospital corpsman who worked in emergency medicine and surgery in the U.S. Navy. He has since held leadership positions, including Chief Operating Officer at San Mateo Medical Center and Executive Director of Dignity Health Medical Group. Driven by a commitment to health equity, he works to ensure access to quality care for all people, regardless of socioeconomic status. With that, let's welcome him to the stage. DeAndre, welcome to the show.
Oh, wow. Thank you. That's very kind of you. Very kind introduction.
Well, you have quite the accolades to cue off with. Now, I got to meet you first at a New Year's Eve party, a kid-friendly one, in fact, hosted by parents from our community. When I learned that you serve as Executive Director of Community Health Trust of Pajaro Valley, I was compelled to invite you here because I want to learn more about all of the things that you're doing to impact community health locally on the Central Coast of California. I also think that this could offer some really great examples to people that are working around the United States to try and build better systems that can serve more people. So before we get into all the impact that you're having, I'd first love for you to share a bit about your history, like what compelled you to go from an early, more military-focused career that likely prepared you to be a surgeon to now work in healthcare administration and social equity.
Yeah, I mean, it's definitely a shift of thought process. But what I thought, and I have no, disrespect to the front line and those of nursing and physicians and all that, but I just felt like I could impact and do more if you change the system and you move it around. And I called it kind of like the Rubik's Cube. You know what I mean? I like that, like where you just kind of you move it around to make it fit to what it needs to be in the right things. And so I just feel like I'd have more impact if we had an opportunity to kind of change those different things around. And so I think the people on the front line do a great job. They get to see their impact and work one-on-one with people that are sick and ill. And I figured, well, let me work on a system that makes people sick and ill. And so trying to figure out a way that I can make the world a better place, or at least my world and my square, a better place for the people that are around me,
Yeah, I mean, I think too often the healthcare system is really a sick care system. Like that's what we're kind of taught. You go to the doctors when or if you're sick for the most part. So I think that's part of the problem. Now, I thought this would be a really great spot to kind of start this conversation talking about the problems. So if we were to identify, let's just say what the primary challenges are in our present healthcare system, what would they be? Like, let's say if you could name 3 challenges, what might they be?
Oh man, that's a great question. What first comes to my mind, I like history, right? And we made some decisions over history that they're coming up to be a problem. One being mental health, right? That we all know about this being an issue now. And I think about it like we made those, as you mentioned, like those sick things. So a long time ago, it used to be doctors that used to come to your house. There used to be small little institutions that came or that existed in every community. Well, the changing of payments and all those other things like that, some of those things went away. And so what went away was that personal touch, was that preventive touch, was that being out there in community. So those small guys don't have that, don't have access to that, or cannot access that the way we were shaped. So we lose a bit of us being a neighbor. You know what I mean?
Hmm.
Being a neighbor in healthcare, being that person in that. And so they try, and I think some systems do very well and some don't. But we lost that personal touch. And that is where prevention and all that stuff starts at. So if I say one of the big things is being more preventative than being more, proactive than being reactive, right? And you can take that across the board, right? Of different things of trying to be a little bit ahead of the game instead of behind the game. And if you get to those things ahead of time, our death rates and our birth rates and all these little bitty things that we continue to have problems with as a nation slowly start to go away. Will you always have them? Yes, you'll always have some type of crux or some type of thing. But will they be at the levels of where they're at now? I think not. The
Well,
second one, as I mentioned, is that I'm sorry if I,
no.
but
So the first one you're really saying is it sounds like community engagement by healthcare professionals.
yeah, being involved in that community at a different level than what it used to be, and because the systems are set up such a way that we can't be anymore. You know what I mean? And so, how do we go back to some of that? We lost some of that trying to be good. Not saying that we're trying to be bad, but trying to be better. And in that, we lost some of that. But the second thing, and I know mental health is a huge issue, but really, it's mental health at a community level. And so what I see by mental health at a community level is those places that you could go where people felt safe,
Hmm.
where they felt safe to be at, where they felt okay to be themselves, where they could have these open conversations, and it's not an overridden anxiety thing, right? Where you can unplug and not be on the screen, where you cannot be on these certain things that sometimes drive your anxiety or drive you to think a certain way because that's how the system is set up. And so I'm like, how do we get back to that community level, right? How do we get back to that to where we maybe unplug a little bit, have those safe spaces where people feel like they can be themselves. And I think that goes a long way to mental health.
So it sounds like to me you're talking about a healthy and safe third place. Like you have the first place might be your home, the second place might be work or school. That third place that is really engaged in community. I mean, in old days it'd be like the local watering hole, but alcohol consumption isn't always the most healthy thing. So what is that third place, right?
I mean, that's, for us as an organization, we're focused on that of bringing, wellness centers to life again. They used to be community centers. They used to be, like a lot of places where they used to be at is the YMCA's or those different organizations that used to be in every community and used to be supported by the community in a way that was the third place, right? And so how do we bring those type of centers, those type of places where you can take a health class, where you can go to an exercise class, where you can, just see your fellow neighbor, right? At something like anything like that, right? Like we bumped into each other the other day going to, like that type of environment where we just bump into and say hi. And so how do we create those little spaces where it's okay to just be, and there's education there to help you educate about your health. And if you really need to see somebody about your health, you feel safe in that environment to take that advice and go to the next step if you need it.
Okay, so that's really, I have the one, two, three here, and it sounds like community is the common theme. So I think that's what we're going to be talking about today. But, community engagement by healthcare professionals, having that mental health space, that third place that we can go to that enables you to engage with community. And then really, you're talking about something like a YMCA. You know, this is something I have also spent some time thinking about because a lot of the health clubs now are very expensive, right?
Yep.
They almost seem like it's somewhat elite. You're paying $3, $4, $5 a day just to be a member. And some people, frankly, don't have that extra resource just sitting around. YMCAs were also typically supported by community, and so the rates would be lower. And they would also often include a lot of other things. Like, for instance, there's Camp Campbell, which is run and up Highway 9, which has an affiliation with YMCA of Santa Clara or Silicon Valley. I can't remember which. At any rate, they have an overnight camp that I'm going to be sending my son to in the summer. So he gets to go for 2 weeks to an overnight camp and engage with different community members. Some of those people will be from over the hill. Some will be from Santa Cruz area. And it will enable him to meet other kids that go to different schools that have different backgrounds, and also have some full time away from home to maybe appreciate home a little bit more.
Yeah, right. I bet. Yeah, but it just is that, but also that socialization, and you learn different environments. You learn how to do that, and you learn in those interactions, right?
Mm-hmm.
And you learn a little bit about yourself in those interactions. So it's kind of cool that I like I said, it's still around in some bits and forms, but it's not. It's pricey. It's expensive. It's hard to get to. It's not access is a problem, you know. And I'm like, dude, how do we lose that in this, in this scheme of trying to make everybody better? We lost some of our home cooking.
We lost some of our home cooking. Now, you're also reminding me of a relatively new friendship I've developed too with Dr. Stephen Lieb, who's a retired medical professional. He's a vegan doctor who works with a few different people in his retirement career, which is more community service, right? He, for instance, does walks with a doc in the redwood forests and Henry Cowell, where on Saturdays, once a month, people can sign up to walk in the redwood forest with him and talk about life. And maybe he's giving them a little bit of health guidance here and there too, but really it's just more about community engagement and getting outdoors and enjoying a healthy habit. I love this retirement career. He's also supported the not-for-profit that's local to us called Eat for the Earth. Now, I understand that you're familiar with Beth Love and Maria Jose Hamel. I've had her as a guest on the podcast to talk about what she's doing with Salud en tu Plato, which is a community a community health program that they have in place in Watsonville. I would love for you to talk about what you're doing with, I believe they're using a model that you helped to create from our earlier discussion.
Yeah, I guess it's Veggie RX. Mm-hmm. It's kind of a veggie prescription program. And so it wasn't necessarily us that created, and I'm not the creator of these things. Really, was it for us was that we had a research project done. We had very smart interns that we try to hire interns, and they did research project on food insecurity. And so that food insecurity about where is food insecurity and where these foods deserts at and where these food pockets seem at, where the only choice there is unhealthy choices, right? And or fast food, or actually no food for miles and miles and miles that can relatively be healthy. And so as we looked at that study, then that became, like, what do we do about that? Like, how do we help that? Like, what do we do there? And so our thought around that was like, okay, what if your doctor could prescribe you veggies? Would you eat them then? like, would you because the price and the food, and as we live, we say we live in the salad bowl of the world. And I make the joke is like, we feed the world this salad, but we don't get a chance to eat it ourselves sometimes. And so how do we close that gap? How do we close that access? And so we were like, okay, if we can come up with this program where the doc says, hey, you need veggies in your life, here, go get it here. And so we created a farmer's market where you can go pick it up at. We also have our location where you can pick it at. And just so recently we started saying, hey, how do we deliver these things? So now we're delivering boxes to people, with these veggies in it, and saying, how does that transform your life? Does that help you make a decision when you have, $5 to spend? Makes you feel more valuable to spend $2 on corn or something else healthy versus, and I don't have anything against McDonald's. Everybody has to get a nugget every once in a while. But how do you decrease your reliance on that and increase your reliance on fresh fruits and vegetables? And so I think that veggie prescription program has been going pretty well. We've been doing it for over 4 years now. And so it continues to be supported by a group of people and so that has taken off to a lot of different places. They do it across in different places. And I feel like oh man, our little idea has now been implemented in many different places and many different spaces, and docs are now prescribing veggies all over the place, and these individuals, and it actually takes a lot of different work, and I want to appreciate because the people who make this really happen that don't necessarily get that is our farmers, because if it was a relationship with them in trying to decrease food waste, right? And so in trying to decrease food waste, yes, there's food they got to ship out that looks a certain way, has to be with, but they have tons of food that they're trying not to throw away. How do we, and so in helping that food waste category, if it wasn't partnerships with farmers, then we wouldn't be able to do this veggie program as well. So it's really making these connections to the community and saying, okay, you got a goal, I got a goal. How do we mesh those things up and not have food waste, as much food waste, and get that food out to the public, you know?
Now, I understand that you also support a number of not for profits with grants, including, for instance, Jacob's Heart, Life Lab, and many more. I wondered if you could showcase for us an example of how you're using some of the funds that you've been able to secure and what that might look like.
Yeah, I mean, we do grants every year. Funny thing, our grant cycle is open right now, and we look for organizations. Like, we look at it in a multitude of ways, right? We say, is this something? We look at the problem and say, is it something that we can do? Is it something that we can advocate for, or is it something we can partner with somebody to bring? And so we have great partners out there in the community that are doing this great work. No need for us to do it. How do we support them? And so we support them through grant funds that we're allowed to do, and we send those grant funds. But the cool about it is that these projects happen, and then we get to have a little meeting about, like, tell us what occurred and what did. And in the case of, I mean, I can go through a numerous of them of some great outcomes that we've been able to see in changing people's livelihood and helping. And Jacob's Heart, and for instance, is, they're a huge cancer center,
Mm-hmm.
and they bring cancer to the level, for little kids, for families, and they are that community backbone. Because if you end up with cancer, and you say, "What do I do?" That's the organization you turn to and say, what I mean, walk me through this thing, what I mean? And so many stories of that. And so in that process, we deal with wellness and they deal with cancer. And I'm like, cancer is a part of wellness. And so how do we support their story and make sure that? And so what's cool is they have a little refrigerator where they give food out. They give food out and they deliver food. And so we're like, what? Wait. We're both delivering food. This is great. All right. So let's figure out how we, mesh each other's and support each other program to make sure that these families who just now got hit with, the cost of healthcare at an extreme level.
Yeah, because
Um,
often, I mean, only a certain percentage is covered, or they got to meet a minimum, and yeah.
yeah, and all that. So they just got hit with a, crazy healthcare bill, I mean, unexpected to their family. And so now food and the basic needs are just taken out of it. So how do we continue to support those basic needs for these families? And so we're appreciative of our partnerships with these organizations who are out here that you don't get to hear about too much, that are doing the work. And we just say, hey, how we can continue to support that work.
Yeah, awesome. Now, I wondered if you could talk a bit about this upcoming project that you're working on. This is called, I think, the Community Health Trust's upcoming Centro de Bienestar. I don't know if my Spanish pronunciation is very good, but I can try.
Well, that's just basically the wellness center in Spanish, right? And because we serve a lot of Spanish speaking population, we felt it was important to highlight that name and the name of the center. But really, what it is a wellness campus where you can come to this campus and be met spiritually, physically, and mentally there. And the three things that are happening there, one is already there. It's called Somos, where it's kind of a open spiritual conversation. It's not one denomination. It's just talking about those different things, how you pray, what do you do, and it's a coffee shop, just a coffee shop to have a, you know, good conversation about where you're at spiritually. What also will be there is we've been fortunate to partner with Stanford Healthcare and the state to bring Alcove. Alcove is a youth mental health center for ages 12 to 25. It's just a walk-in mental health center, right? And so you walk in and you can get care from, you can go all the way from just talking to your friends and doing some fun exercises and things like that, to all the way to seeing a professional for mental health. And if it has to go further than that, then we connect you to those different avenues and partners down the street. To right across the street is like a teaching kitchen and a multi-purpose room where, and I always make this joke, like I do these, like these is some senior citizens that rock the world. Let me tell you that. And they do this chair yoga class. And I'm gonna tell you, I apologize to them profusely because I thought, chair yoga, come on, I'll do it. 15 minutes in, I almost died. This is the hardest. I was like, oh my goodness, right? So, but it's bringing those different classes and those things for people to get involved in. We have dance classes and things like that, and also where you can see our nurse practitioner to just talk about your health, right, and talk about it in that. And it's led by, because we have diabetes being a huge problem in Palo Valley, in this community, and a lot of different communities, but especially in that community. And so that conversation that's led by how you eat, what you eat, what's going on with your health, how can we get your medications and all those different things. So let's have a wellness chat with you about that. And you can have it with a professional, that can work through that. And then we have the teaching kitchen where you can come and learn how to cook those different things, right? And people don't know what to do with, with bok choy. We can teach you how to do it. All right. I know bok choy is not high on the list of things like, what is this? But it's actually can be very tasteful if you know. And it's really not about making you eat. That is like, what can you change for this, and how can you make adjustments to your diet and the things that you do in your family to make you feel better. And all of this will be on one campus. And so what this is a model for healthcare, right? And remember, I spoke a little earlier about there are small health systems that are out there doing a great job, but they can't do it all. They need to focus on you being an inpatient or you having some kind of physical deal. And when you walk out of there, you're not on your own. Where you go, come here. You're not on your own. Come to the wellness center. Come to that space where you can come find anything that you need, from just having an educational class and learning how to cook, or learning how to walk, or reading a book, or having a spiritual conversation, or if you need to have a mental health conversation, that's the space where you go. And so we want to take those centers and put them in every community where there's a space where people can go, feel safe, be easy, and have any conversation you want to have about your health. And that's the part of bringing that community back together in that space.
Yeah. Well, you're reminding me of a couple of things. One is I've interviewed before Dr. Joel Fuhrman, and he's, written several books on health. He's pretty well known. He has a center in Southern California that he runs where he invites people in. Now, it's not inexpensive, right? Like it costs,
Right.
10 grand to participate, something like that. But he will have you live on his property and teach you to, participate in the right health activities and for what your activity and health level is, right? Eat right, like clean up your diet. And he gets people off traditionally of 5 or 6 medications that they might be on during their time there. He works with a lot of people who are type 2 diabetics, and essentially over the course of a 3-month period will move them out of being a type 2 diabetic. So it takes people that are at the brink of health collapse and returns them to health. Now, it's very regimented. It's not easy. You're going on a whole foods, plant-based, no oil diet. It's quite strict, right?
Yeah, sounds strict.
But transforms people's health, and has demonstrably done this for, many, many people over the years. And, if people had access, in my mind, to something like what you're describing in an ongoing capacity, they might not get to the point where they're at health collapse, at, essentially death's door. Some people have something like 95% occlusion in their arteries, and they're just like, they're looking at a triple bypass to get them back on track. And, if we can instill something earlier, then we can help people in a much greater capacity without having to incur intense expenses, right?
Yeah, we take that approach of if I fish for you, then you eat for today. But if I teach you how to fish, you'll eat for a lifetime. And so we're trying to teach you how to fish there. And our program is not Doesn't matter if you can pay or not, right? It doesn't matter what you can pay. We work with insurance. We don't work with that. So it's really about your health and how do we put that in the forefront, and how do you come to that space any way it goes. So we're in there trying to teach you how to fish, right? And it is some regimented stuff you got to do. It's some changes you got to be ready to make. It's some changes you got to make for yourself. But I think if you keep showing up and we're there in the community and we keep showing up and you keep showing up, it eventually comes, it really comes through, right? It really starts to come through to you and you start to make those changes, even small things can make a big impact.
So, I mean, really what you're talking about is a transformation. It's not the typical healthcare system, but I also wonder how it's paid for. So when you talk about the fact that you take insurance or no insurance, it's like, well, what if people can afford, they can't afford, like how do we end up paying for something like this to serve a community, especially like one in Watsonville, which you're talking about, an area that is traditionally lower income, many
Yep.
farm workers.
So that's it. That's the magic. We are supported by a large. We had started the organization from a large endowment, and so I kind of self myself as a little bit of a Robin Hood. And most of my job, I actually work with organizations in learning how to invest funds. So I'm really investing money to invest money back into the community. So how I'm using the stock market and the exchange, and so I've spent a lot of my time really talking about that stuff. And they're like, "You do healthcare, or do you do finance?" I'm like, "I
Yeah,
do
both.
both, a little bit of both, right?" And so because we do that, and so we manage our money in a way that allows us to support these different programs, and then we fund different things at different levels. So, and we do a little fundraising. I won't say we don't. And then we've worked with insurance companies and kept our costs at a low amount. So we don't necessarily have a physician. Not that I don't have anything against physicians, but the cost for a physician versus a cost for a nurse practitioner,
Mhm.
our model is at that level, right? And so the level of the cost of a nurse practitioner versus a physician is half, almost half, right? So it keeps our costs low to have that. The person who's led healthcare for eons, like I said, history, has been nursing. Like even
Yep.
anybody else, right? It's been nursing who's led healthcare for years, right? Supported both levels and all levels. So we feel like having a nurse or a nurse practitioner in this case is the play of both worlds, right?
Mhm.
And it helps us keep a lay in the community and understand the whole gamut of healthcare. So we keep our costs low in that perspective, but I really do a lot of management of money, and so we call it kind of a Robin Hood kind of thing. I I take all these ways that rich individuals have made money. I try to apply it to how we move money and shake money.
Mhm.
We've been very successful in doing some of that, and we take that money and pump it right back in the community.
Fantastic. Like, I'd love to see this amplified into many other necks of the woods. Now, I know you spent a fair amount of time thus far talking about mental health. And I think, especially right now, and especially in the community that you're working to serve, Pajaro Valley area, a lot of farm workers, many of whom may be undocumented. We
Hmm.
have ICE raids happening right now, which
Yep.
are completely upending families around the Central Coast. I wonder if there's a particular way that you're able to serve them now that may not involve them coming out to the community center, because in some cases they're, simply not comfortable even leaving their homes.
So we have constantly had, I actually had one today, conversations with the local police authority about what's right, what's not. There's been constant communication about know your rights. And we've been promoting these places where they are safe, where you can come and learn about your rights and learn about what you have, right? We also promoted our organization as one that we don't take your information and share it. We don't take your information and do anything with it. This is what your rights are, and this is what we have. And our environment has always been a safe environment, regardless of your status, right? And we care more about your health than we care about your status. And so we do those different things. Plus, there are in state legislation, which we are kind of working with to make where safe spaces exist, right? And this has existed for a long time. It's been a list of safe spaces. School has been one. Healthcare has been one. And so we're trying to make sure that list and that policy stays enacted. Because if we come after that policy, then it gets a little shaky because you don't want to go anywhere because ICE can go anywhere. And so our environment and our space has been in that list of spaces that are safe, right? That you can go to and be in and not have to worry about those particular items. But there is policies that we have to make sure stay enacted. And I don't know how that's going in today's society, but we're still fighting that fight to make sure those things stay safe.
Yeah. Well, I certainly have been, let's just say, concerned for not only those individuals, but even thinking about the cost of food, or, are the harvests actually going to happen the way we need them to right now because of this particular issue? I mean, on the central coast of California, we're always in harvest season, right?
Yeah.
There's always something growing that needs to be picked or maintained.
Yeah. I want to see the president go to a restaurant after all this stuff. You won't make it to one. I know this story of saying they're saying like, hey, they're taking our jobs. I'm like, what job do you want? You could apply for that same job. People are not applying for those jobs at that level, right? And so it's been immigrant over years. Like, this is history. Like, you know what I mean? African American, population, right? Were the immigrants, right? Whatever immigrant was it that had, and unfortunately, the lowest paying jobs or the jobs that a lot of people didn't necessarily want to take. And that's just how this country has been forever, right? And so now,
Janitorial,
janitorial, this and that, and
food
those jobs have been
service,
food
house cleaning.
service,
Yeah.
janitorial, housing, this, like, name them, right? And you can name over the years. It was Italians and Polish, and then African Americans, and then so name the history of that, where those who were immigrants or those who came over this country, good, bad, or different, played that role.
They tend to be manual labor, painting your
Tend to be
house,
manual labor.
construction site, like all of it.
Construction, manual, like all of that, right? And so if you now want to do that, right, how do you expect all those things to necessarily happen unless we reorg ourselves? So what's the plan? You know what I mean? What's the plan to reorg? And there's no plan in that. It's just, we got to do this.
No, it's just,
right?
we'll find qualified people to do the work.
Right. And I'm like, well, you're going to either have to pay them at this level, right? Which that ain't happening, right? That ain't going to happen, right? Because people are not going to take jobs less than this amount because the economy is a certain way. So it's an evil, as I say, evil circle of like impact and stuff like that. And in healthcare, they used to call it the triangle: quality, access, and time. And you can have two of them, but you can't have the third. And so where do you shade off in that? And the best part of it is trying to make a circle in the middle of that triangle, right? To touch all three, but that meant that you couldn't help everybody. So if you want to help a massive amount of people, you choose the two and you leave one out. So if you have high quality and good access, you won't have enough time to take care of everybody.
Well, and then there's
right?
the money equation, right?
And then
Where
the
does
money
that one
equation,
fit?
right? Yeah. Yeah. And so I'm saying, so all of those different things, play in there. And so it's called the healthcare quasm. And that's always been a thing in healthcare for eons and decades, right? And so how do you impact that? And so it's the same thing in the economy and in the world. Like, you want to shade and shake all these different things. Okay, you're going to get these two things, but you're going to lose this. And is it worth losing all of that or not? And so in the most cases we found, it's not worth losing that. And so hopefully somebody comes and just say, hey, it's a math problem, man. It's an equation.
Well, this is
And
why
maybe-
it takes somebody who has experience working in the sector to make the right decisions, as opposed to just, somebody who doesn't have the experience, right?
Yeah. Or somebody saying like, I think I can do a good job. I always think I can do a good job too, but I'm not, you know what I mean? I always think I can do a good job, but I don't run McDonald's. Right. So, right, I'm not qualified for that. So, get somebody qualified in there to do the deal. So, but I mean, for me in an organization, and what it doesn't stop for us is that we're going to keep fighting for the people and fighting for the community, regardless of what that community is. We're going to fight for the community and their wellness and their health, and make sure we try to keep that in the forefront. So it's safe to be around us. We care about your health more than we care about everything else.
Well, you're focused here on the central coast of California. Are there other sister efforts or brother efforts that you would refer to in other arenas that are doing similar work?
There are some great organizations out there that is doing a fabulous job around health and wellness. And there's different models in different states. There's, believe it or not, there's one in Florida, right, that actually built a whole 80 square foot wellness center in partnership to have these different things come back in the community. And they serve 3 or 4 underserved communities in that area, right? I think it's outside Orlando, you
Mm.
know.
I
And
imagine you meant 80,000 square feet as opposed to 80 square feet.
oh, 80,000. Yes, you're correct. Thank you.
I was like, that would be pretty tiny,
No, no, no. That's an 80,000 square foot building. You know what I mean? To
which is
have
huge. An 80,000 square foot building is like, a very large big box store, just to give people
very large,
an
yes.
idea.
And so they have a walking track in there and all these different things. And so, but they created that in their community to do that same thing, to bring these different things together, to bring these different stuff, to really talk about wellness, right? About about wellness, right? And it's about wellness of the community. So there's different models out there to see, but I think all of us in those different models say the same thing, right? And similar things of putting the people in the forefront, taking care of the community, and then caring about them and their wellness. And that will propel the community, push the community forward, and keep the community healthy and strong, And if you have partners that are in healthcare or hospital partners, it makes that even stronger.
How are you? How do you envision keeping costs for something like that more manageable? Is technology coming into play to support keeping costs lower, or how do you envision that?
EMR has been great, right? Like, and the ability for EMRs now have
What is EMR?
gotten
Sorry, I mean,
electronic medical record,
ah,
EMR,
okay.
or EHR, electronic health record. But in those electronic health records, they have now gone to where you can like Zoom with a patient privately, or that you can get an appointment on your phone, right? And so that used to be only available to the Kaisers of the world or to the dignities of the world who had that big pocket to pay for those things.
Hmm.
And now us small guys actually got it, and we're out in the community. And so it's like, use your phone and get a hold of us, or those different things like that, so that we can do that. And our ability to get on that has allowed us to actually reach more people when they need us quickly,
Yeah.
or when they need advice or when they want to know something, they can reach that and get a phone appointment or video conference us and that. But the same old adage, though, we still believe that you got to go see the people where they're at. So we still go out. We have promotores, which are really like an extension of the physician, and they go out into the community and meet these people where they're at. Because remember, I said back in the day in the '60s and all that stuff, it used to be a doc come knock on your door and take care of you and your family in one fell swoop. I'm
I used to
like,
have a milkman also bring milk to your door.
yeah, yeah, I know, right? So I don't know if we could be the milkman, but we do bring health to your door. And so we got promoters out in the community, out and about, talking to you about these different things. And they are your neighbors. So now you want to have a conversation, right? And now you can have that easier conversation with more like a friend in the community who knows about healthcare. And then they say, hey, well, why don't you go get this is over here? And they know about the resources in the community, and they connect you to the resources you need. And so it's a friendly face coming to your door saying, hey, I don't know what you need. Tell me what's going on, and I can try to help you get where you need to go.
Yeah. Well, this has also helped to revolutionize things like mental health care, like BetterHelp is an
Right.
example where people can,
Yep.
you know, have a much more affordable option than what was typically a 1 hour visit at the psychiatrist or psychologist's office.
Yep.
So getting something that's more affordable because it can be zoomed in and that you can find the right therapist for you through one of these services.
Yep.
Do you employ something similar?
We do. Yeah. So you can get to us from those different avenues. We have people who just their whole job is to be online. They're not even coming to the office. They just answer your call every day, all the time,
Mm.
video or not. We use multiple different languages to try to make sure we get a hold of you.
Well, I feel like we've covered a lot of territory here. What I'd love to be able to do with you in this last stage of our interview is to offer you the opportunity to either kind of position some closing thoughts, things that you'd like people to think about as they depart today's conversation, or if there was a question that I haven't asked that perhaps you wish I had, you could ask and answer it.
No, I think you do a great job. This is amazing, and I appreciate you inviting me and thinking of me in this regard to come here and share this story. It's amazing. What I'll leave the people with is this, right? There are organizations and people out there who are doing great jobs. There are nonprofits in these different communities who are working every day and hard for you. and you might not see them or know them, but please know that they're there. And, I'm happy and proud to be a part of that group that is out there trying to work for the people. And find us. Come get us. Come find us, because we care more about you as a person than you know. And we care about the community more than you think. And so when you don't have anywhere to go and you're wondering what's happening on the big stage, come see your neighbor. They're a nonprofit. They're your neighbor. They're there to make sure that those big conversations come down to you in a fair and equitable way.
Yeah. And I'll also say, if you're feeling at a loss, like if you have something to contribute and you wish you had somewhere to spend some energy to feel like you're giving back in your community, getting involved with a not-for-profit like yours, seeing how you might be able to apply some of those skills is a great way to give back to your community as well. So.
Oh, yeah. We take your time and your money and both. No, I tell anybody there's multiple different ways to give. And you give from your heart. And so is it time? Is it money? Is it both? Get involved. Get enacted. $5 helps. $10 helps. $2 helps. But 2 hours of your time. Because we even have some of these programs where we have people go out and just hang out with seniors because they're by themselves at their house. And like, what are they going to do? So go by and hang out with somebody. See how they're doing. Check on your neighbor.
Well, that's a very good reminder. Thank you so much for your time today, DeAndre. This has been my pleasure.
Mine as well. I appreciate it. And I'll see you at the next,
shindig.
Shindig or the next, office visit somewhere. We'll bump into each other in the community. But I appreciate the time and appreciate what you do. You're awesome and amazing. So,
yeah, thank you, DeAndre. To find out more about DeAndre James and his work with Community Health Trust of Pajaro Valley, I encourage you to visit our show notes. You can visit the blog page for this episode, linked directly from there on caremorebebetter.com. It includes a video version of this podcast, complete transcripts, links to Community Health Trust, and the many resources and past episodes that we discussed today. While you visit caremorebebetter.com, please join our newsletter. For every new subscriber, we're planting a tree through our partnership with Forest Planet. Thank you, listeners and watchers, now and always, for being a part of this pod and this community, because together we really can do so much more. We can care more. We can be better. We can improve healthcare access and the health of our communities. Thank you.
Thanks for listening to Care More, Be Better, a podcast for social good. To make sure you never miss an episode, subscribe, rate, and review wherever you listen to podcasts, and share with your friends to help us reach more people and spread more social good.